We're here for the animals from, we always say, cradle to grave. We're here for their entire life and make sure that they have the best life possible during that time. Going through this year with the pandemic with COVID-19 has changed a lot of the things that we do and how we have to operate. First and foremost, it has changed how we deal with some of our animals because there are animals that are susceptible to COVID-19. Our first step in the very beginning was to really look through all the animals we had here at the zoo and try to determine what was the level of risk for each species and how were we going to take steps to keep them safe. A lot of that involved taking the things that we're already doing with ourselves, of social distancing, wearing masks, and other PPE to how we care for them. We knew that we were going to be able to make those changes and do it successfully. But early on we didn't know when would we have a case or would we have a case. And as of yet, we have not had a case here at the John Ball Zoo, but it has happened at several others. So I think that our team did a really good job of sitting down and looking very carefully, not only at the steps of keeping people safe, keeping animals safe, but we also had people that were focused kind of on keeping the zoo safe and looking at our budget, how do we adjust things. So there were many different things that had to happen, and it wasn't without a loss, but it was not a loss that put the animals at jeopardy.
You're just too strong. You're just too strong.
For my role as a veterinarian, my day is never the same, but one thing that is usually pretty routine is the weekly pattern that I take. And Mondays are usually my weekly rounds, where I engage with the keepers in all areas of the zoo to kind of check in on all of the cases that are going on. And then through the week, we schedule procedures and planned events for different animals based on what they need. Rounds historically has been a physical trip through the zoo where I stop in every building. I think I oftentimes have somewhere between 30 and 40 different cases that I see in that weekly rounds. But as we got into kind of out of the summer and fall where weather was nicer and everyone was moving back inside, we were seeing in the community a greater spike of cases of COVID-19. And so we had to really adapt how we operated with each other so that we weren't in each other's space more than we needed to be. And that's where the idea of virtual rounds kind of started. Hey guys, how's it going? Hello. Instead of having individual meetings in every building, now we actually are able to get together with the entire section of zookeepers, and we're able to talk through all of those cases and get even more input on what's going on. So that's been a benefit, actually. What we often end up with, though, is there's a limitation to that because then I can't see the patients very well. The keepers will sometimes send me photos. They might send me videos, things that I can use to start to make some judgments. But I usually kind of create a list as I go of animals that I need to follow up with either later in that same day or later in the week so that I get the physical rechecks in too. There's a much more benefit to being next to the animal or near the animal to see what we're talking about. So we'll probably find some sort of combination or hybrid of that, but I think it's been interesting throughout the pandemic that some of the ways we've learned to adapt to the pandemic, I think, are going to give us new tools that we might continue as we go on.